Welcome to Common Ground with SMK Medical, where healthcare professionals unite to tackle the industry's toughest challenges. Today, we're thrilled to welcome Denise Winzeler, a seasoned curricular development specialist at Apakin. Denise brings a wealth of experience as a registered nurse and licensed nursing home administrator, with roles ranging from quality coordinator to executive director of nursing and regional clinical manager. She's been pivotal in clinical oversight and delivering education across multiple long-term care settings. Today, Denise will share her insights on what it takes to keep long-term care team members committed and motivated every single day. So be sure to follow SMK Medical on LinkedIn and on Facebook, and subscribe to Common Ground with SMK Medical on your favorite podcast platforms. And if you'd like to be a guest on our show, feel free to email us directly at info@smkmedical.com. Now, without further ado, let's dive into the conversation. Welcome, Denise. How are you doing today?
I am great, Demetrius. Thank you so much for having me today and for talking about this extraordinarily important topic.
So, my guests are used to seeing, or my listeners are used to seeing my guests on screen. Denise is having some audio-visual issues, so we wanted to make sure this happened. We wanted to make sure this podcast goes off. So you just get me today. You just get to look at me. But I did, spice up my background a little bit. So maybe next time, Denise, we can get your camera on, and hopefully we don't lose you throughout the process. But I just thank you for coming on and sharing your expertise with us. So thank you, Denise.
Yes, no, thank you again for having me. And hopefully, fingers crossed, this will hold out because the storm is not going to go away.
So let's dive into it, right? And the purpose of this podcast is we want to talk about keeping your team. And you have a free tool that you'll be sharing with the listeners at the very end of this from Apakin. But, you're a registered nurse. You're a licensed nursing home administrator. And in doing my research for this episode, I've noticed that you've been on plenty of podcasts, plenty of stages talking about employee retention and workforce development. So I don't want to rehash what they can search for online, right? You've talked about this topic, but I really want to approach it from a different perspective. I want to approach this topic from the people perspective. I think we're often talking about employee retention from the company's perspective, but as employees, as nurses, we've both worked at places. As administrators, we've both worked at places, and I'm sure you looked around at the wall and said, I don't know how many more days I'm going to be here.
Yeah. Yeah, and that's exactly right. And, our staff are doing that as well. And with everything that is going on between, of course, the staffing shortage, the upcoming staffing rule, everybody's talking about recruitment, but I want to focus a little bit more on what we have and the retention of those great employees, because truly that's where it is. I mean, when you have increased turnover, it affects so much. I mean, not only is it a financial burden, but it affects things such as your 5-star, your staffing rating, it affects the morale of your facility and the care, ultimately the care of your residents, which is what we're there for anyway, right?
100%. And I'm so glad we're talking about this from a different perspective, because the number one thing I hate, and my wife said, don't use hate. I hate the most is the fact that organizations don't focus on their current customers or their current people, their current staff. And when I say customers, I always tell people, as leaders, our customers are not only the patients, it's the staff that we serve. And you see this practice all the time. And now, right, we all have cell phones. We all have this handy thing near us. It's like when you're being wowed from a cell phone company, you come in, you can get the newest iPhone, you can get the newest Android. But once you're a customer, we don't want to hear from you. You don't get it. You don't get anything new or free. They're doing nothing to satisfy me and keep me there. And oftentimes, as you mentioned, I see them putting all this effort on recruitment and retention. But what are we doing for the staff that we have? And I think that that's sometimes lost in the sauce. for various reasons. But what are some of your research showing that, what is some of your research showing in regards to employee retention for the staff we currently have?
Yeah, so I was reading, I can't even remember where I read this, but the turnover for long-term care is 54% or higher, depending on where you're at. And that just blew me away because
Yes.
that's more than hospitals. That's just an incredible number. And think about all of, and most of that turnover happens within the first 90 days.
We got
So,
you. We don't do anything to keep you.
right. Or we bring you in, but we don't give you enough information, enough resources, enough backup for you to do your job and learn your job appropriately. And so you're just like, oh, forget it. I'm moving on to bigger and better things. And so I think the very first thing, we have to be creative. What we were doing in years past, let's face it, it's just not going to work anymore. And so we have to start being creative. And when you're looking at, you're starting with the people that you're bringing in, you really need to take a good look at your onboarding process. Are you giving these new staff members the information, the support, and the resources to be able to learn their job and do their job to care for our residents?
I have
That's the very first step.
I have a friend, her name is Dr. Sylvia, and she focuses on the orientation process. And I think what you just echoed is exactly why she's in business. We're failing at the orientation process, at least what I've seen. To your point,
Right.
we sometimes are looking for staff. We just want to get them in the door so fast, but we don't provide them the tools. I've walked down halls as a healthcare consultant and I say, hey, where's the laundry room? And the person says, I don't know. I just started.
Right. I mean, right. I think that, it's kind of like the QA process, which is a whole other podcast for us. But, people just have that. All right, we're going to give them a 3-day orientation. We're going to have 2 days where we are going to give them a plethora of information that they're not going to absorb about what to do for fire and all of that. And then we're going to put them out there and, all right, let's go. And for those CNAs or new nurses, even who've never had a job before, that's just setting them up for failure. So you really need to have, and I think too, the same orientation process for one person may not work for the next person. So you kind of
Yeah.
have to have a give and take and, kind of an a la carte orientation for each and every new staff member.
I can't tell you how many times I've seen team members terminated because they didn't pass our probationary period of 7 to 14 days because they weren't just cutting it. Why
Mhm.
didn't we tailor our orientation process or put them back on orientation? We often hear we're short staffed, but are we really short staffed when we're discounting the staff that we have, when we're not putting our all into the staff that we've hired? What
Right.
service are we doing for them if we're not, like you say, tailoring our orientation process? I think is interesting because I don't know many people who have that mindset. The journey has been get them in, act like you're interviewing, hire them. At least what I've seen in some of these instances. Now, that's not every facility, right? Some people, they
Right.
have it, they do a great orientation process. But a lot of times when we have that mindset, as you mentioned, it impacts our 5-star rating. And I don't think that people think about that. They don't think about how it impacts us externally. No, gone are the days that your turnover is just secret inside your facility.
Right.
No,
Right.
that is public data. Am I correct?
You are correct. And yes, it will affect a lot of things. I mean, it's in the 5-star rating now. And, not only is it in your 5-star rating, but your MCOs, managed care
Mm.
organizations, your even your regular community members are looking at that to see whether they want to do business with you. And so when they see that, it may affect that as well. Not to mention, if you have a high turnover rate and you're always short staffed, it's going to affect your surveys. It's going to also maybe get out into the community like, hey, you don't want to go there. They're short staffed, or you don't want to work there. And nobody wants that.
So, how can we as leaders, from a director nursing standpoint, from an administrative standpoint, how can we curve that? What can we do? What are we not doing that's impacting the way that that the way that we retain staff? What can we do?
Yeah, well, the good news is that there are several things that we can do. And let's I want to take a step back, because talking about new employees, before they even get to our facility, we want to make sure that we hire the right people, because I know a lot of facilities will hire them because they came in. We don't want just a body anymore. We can't have that. That puts everybody at risk. And so we want to make sure that you're hiring the right person for the right job. So make sure that when you're interviewing with the right questions for that job. And then, as we talked about, the orientation process once we get them on board.
So, what are you said the right person? What's the correct way to do this then, right? I can only speak from my existence in my style and what I know coming up. I started off as a CNA. I was introduced into leadership at the age of 19. I was given a whistle and a shirt that said leader. And I was then supervising people. I then went back and became an LPN, and there was a leadership component of my LPN for about 2 weeks. I went back and became a registered nurse, and there was a whole leadership course at the end, and that focused on caring for 4 patients. So I was becoming a leader because I was caring for 4 patients. At the bachelor level, there was no leadership course. At the master's level, there was no direct leadership course. And at the doctoral level, which I am officially 5 classes away, there's nothing there. And when I say leadership, I don't mean your basic leadership classes. I mean, where do I learn how to interview people? Where do I learn how to gauge if this is an appropriate hire? Where do I learn how to interview to see if this is going to be a person that's going to gel with our residents, but also the milieu, the staff that I have. So, from your perspective, how do we learn that as leaders to interview appropriately? Because what you stated was you got to be able to ask the appropriate questions. But how do I learn that if I was just given a whistle and a shirt that said leader?
Yeah, absolutely. And like you said, there are no classes out there, so it's kind of learning on the fly. I think one of the important things that a person needs to do, whoever is doing the interviewing, is go back to your facility's mission and vision statement. Know what that mission and vision statement is, and make sure that that person who you are interviewing fits in with that mission and vision statement. A few questions that you may ask them is, for a CNA or a nurse, what do you find meaningful about the type of job or the type of work that this job requires? Tell me a little bit about one of your favorite residents, or tell me a really complicated problem that you had, and how did you solve that? You also want to make sure that they're compassionate, that they're reliable. I don't know about you, but for me, honesty is a huge thing.
But how do you gauge that in the interview? Because everybody, for the most part, everybody shows up doing their best for the most part. I gauge that.
Absolutely. And there are some questions. So, like, if you want to ask an interviewee maybe something to do with compassion, say, tell me about a resident who you've grown close to, and how did they make you a better caregiver? Or maybe you want to see that they're a problem solver. Tell me a time that you were having a difficult time helping a resident, and what did you do about that? If they're a team player, describe a conflict that you had with a coworker and how you handled that. There's always questions that you can answer in a roundabout way to get what you need. But again, always you need to always go back to that mission and vision statement for your and the culture, the actual culture of your facility.
I love the fact that you talked about culture because I think culture plays an important role in employee retention of your current employees, also of your future, right? Because if your current employees are spewing hatred out in the public or they're spreading, the fact that this is not a good place to work, then you're never going to have future employees. But, how do you cultivate a culture where feedback is encouraged and acted upon? I've worked at places as a nurse and I just didn't raise my hand because they weren't going to listen to me. So how do we as leaders, cultivate where we have, people coming to us, they're utilizing, us, the team meet. I mean, they're utilizing the staff meetings to really, be open and honest. How do you cultivate that?
Yeah, so I always say that we need to have what's called an employee first culture. And that's the concept that employees are our best assets of our organization. And there are a few ways to instill that in your organization. The first one is communication. Staff have to feel comfortable coming to you with any concerns, ideas, questions, and they all have great ideas. I mean, they are the first line. So if something is not working, they're the ones that you need to go to, especially if you want to introduce something like maybe a new electronic health record or something. You need to say, hey, what works with the current one and what doesn't work? Because they're the ones that give you that great information. You need to invest in their professional development. Employees need to feel confident in their skills, and they often want to grow their careers. I mean, just like you and I, we started out as CNAs and now look at us. And most of our CNAs and our LPNs and even our RNs, they look to move up the ladder at some point. So it's very important, although sometimes it may be costly, but you get that back. So make sure that you are investing in your staff's professional development.
And that leads to my question that I already was ruminating, right, when we talk about growth, and that is, right, how important, I'll put it here on the screen, how important is career development and retaining top talent in long-term care? And what initiatives have you found most successful that helped you retain that talent in long-term care?
Yeah, that is a fantastic question. And I would love to hear what our listeners are saying about that. I'm one of those people that I always feel if I don't learn something every day, then I feel I've let myself down. So I try to learn something every day. And, that's the great thing about APAC, the company that I work for, is that they truly believe, even though we are a professional development company, they put their money in us to allow us to do professional development for ourselves as well. And so we are always growing and being able to bring new stuff to our members as well.
So I'll chime into that as well. To me, career development is very important. As a leader, I want to instill into my staff a continuous learning environment because it not only impacts us as an organization, it impacts the residents, the member, the people, the patients we serve. And when we talk about career development, one of my biggest, and I don't want to say it's not me, but one of my success stories is back in Michigan. I had a young man. He was a licensed practical nurse. His name is DeAndre. Shout out to DeAndre. Should I say lawyer or attorney DeAndre now? He came to me during COVID and said, I'm here to turn in my resignation. And I said, what are you talking about? He says, well, it's COVID. We can't have casual staff. You can't have, you put this blanket statement out. And I said, hold on. You didn't just come in my office and say you got a full ride to UOD Law School and you're going to quit. First, I need nurses, so you got to stay. But I'm going to do whatever I can so you can be successful. Oh. 2.5 years later, he is Attorney Robinson right now. But I believed in him. He came in ready to quit, and I believed in him and tailored the schedule to make it work for him. And I think as organizations, we have to be flexible. We have to be malleable. Just like we want our staff to be malleable, we have to be malleable. So in that instance, I had two choices. It was either to say, you know what, I can't have casual staff because it's COVID. I need you either dedicated to here, or I had the choice to say, you know what, we will work with you. And he stayed with us for the whole 2 years as a LPN contingent when he could, and now he's on to be a nurse. But he as he told me, a couple weeks ago, he carries that with him. That was an example of leadership for him, and he's forever grateful. And us as leaders, we just have to be malleable. We have to support our team. So if you have housekeepers who want to do more, maybe you notice they're picking up, increased overtime, or they got a second job. If there's somewhere else that you can cross-train them, such as being the CNA, then let's look at how we can get them to go to CNA school. If you have CNAs that are coming to you and saying, hey, I want to be a nurse, let's look at what we can do to offset their cost or their experience into getting into nursing school. Everything doesn't have to be financial. It can just be tailoring their schedule, allowing them to have shorter schedules. It can be, maybe setting them up so they're doing the Baylor thing where they're working, 16 hours on a week, and then they have weekend, and then they have Monday through Friday off. There are so many things that we can do as a leader to promote career development for our team. And I think that when we do that, we gain buy-in, and we also keep our team members happy. I don't know if you feel the same way, but that's what I think.
I do, absolutely. And I'm so glad that you brought up flexible scheduling, because that is becoming more and more the norm, but it's also very, very scary for staffers, for administrators, for directors of nursing. But remember, a healthy work-life balance is critical to job satisfaction. And a way to promote this is through flexible scheduling. And a lot of facilities, a lot of directors of nursing that I have talked to said, it scared the heck out of me to do flexible scheduling, but it has worked out so well. Now, having said that, you have to make sure that you are setting a criteria for your staff to use as they are using this flexible scheduling. But like you, it doesn't mean that Susie has to work every Monday, Wednesday, Friday because that's what she wants. Like our college students, I used to have a lot of nurses or CNAs who said, hey, I want to work, but I can't get to work until 45 minutes after my shift. And I can't be late because, we have the, our policy on late. Yeah. And so I flex their schedule. I'm like, yep, that's fine. I want you to continue going to school and just be here by such and such time. And it saved that. She was very happy, and we were very happy. We loved that she stayed with us. She was a great nurse. Is a great nurse, I should say. But yeah, and it may only be that you have to flex 15 minutes or an hour or whatever. Yeah. It's not like you have to flex a whole day or whatever. And it does work out.
You have to be a leader who's hands-on in order to catch those things. Let me tell you about a time I was getting ready to terminate someone, and they just late, just couldn't get it together, but they wouldn't speak up. You know why this person was late? You want to take a guess why this person was late? One, there was no Uber. There was no Uber in the area, and our shift starts at 6, and the first bus runs in their area at 6:05.
Yeah.
So they're catching a bus to get here.
Yeah, I had somebody who would walk a mile to get to
Yep.
work. Rain, snow,
Snow,
whatever.
sleet.
So we have to be able to give a little bit, because golly, they're giving us a lot.
You, they're giving us a lot, and I think what happens is when they feel like they give, they start to get burnt out. And as leaders, we have to recognize there's the signs of burnout if we want to keep the employees that we have. So in this demanding field, how do you address burnout for your team members so they stay committed? Because we've had them, they get burnt out, they just quit, they just stop
Oh,
showing up.
absolutely,
So
absolutely,
what can we do
absolutely.
to prevent burnout in our team? We're always talking about leaders, right? Work-life balance, but are we thinking work-life balance for the CNAs? Are we thinking work-life balance for that cook who's on their seventh straight day?
Right.
Are we thinking about that? So
As
how
we
can we avoid
continue to
burnout for
say,
them?
yeah, as we continue to say, hey, I need you. Can you please come in? Yeah. Um,
It's
and it happens a lot. I mean, I'm not going to lie. I did the same thing when I was a DON.
yeah,
It happens, unfortunately. I think one of the things that we can do, well, first of all, you need to recognize the signs of burnout. Are they getting agitated? Short tempers? Are they
mm-hmm.
withdrawing? Are they starting to miss work or come in late? I mean, are you seeing a change in their demeanor? Those are the very first signs. And we need to give them a break. I read an article the other day that hospital, I don't know if you read it, I can't remember what journal I read it in, but a hospital was putting in, what did they call it? I'm just going to call it a soothing break room, for lack of a better
Nice.
word, because I can't think
Okay.
of what the actual word is. But they had recliners and soothing music, and they had these things on the wall. It was basically a sensory destimulation room so that their staff
Nice.
could take a break. And they really noticed a drop in their burnout and their turnover. Now, not everybody can do that. However, because I think they put a lot of money into it, but you don't have to put a lot of money into it. Take a small room, or even a closet that one person can go into, and it doesn't take a lot of money to put a comfortable chair in there, and maybe some aromatherapy in there, some magazines, a radio with some, or a CD player. I'm showing my age. With
No. You're not gonna say.
it doesn't take a whole lot. Maybe a few snacks in there. And consistent appreciation. I cannot tell you, and it doesn't. You don't have to go overboard with that, but everyone likes to be appreciated, and appreciation can take so many forms. The small and
Listen,
unexpected gifts. I used to go around with candy bars
I was
and
gonna say
say
that. I'll
thank
say you
you.
look like you need a break. Here's a
Yes, and
Twix.
yeah, or I would go and make beds, and when the
Yes.
administrator of the DNS comes in and makes a bed for you, or says, "Hey, I'll shower Mr. Smith for you," it's just like it
Changes the way that they look
shows
at
that
you,
you care.
their mood.
Yeah,
Hmm.
it shows that you care. And most people leave because they don't like their supervisor. I mean, that is one of the top
Ooh.
reasons that people leave, because they don't like their supervisor. Now,
Oh,
yeah, a lot of times it's about money, but most of the time it's about their supervisor. So show them you care. Just give them a drink or a snack, even giving them a high five when they've completed a task. Just showing them some type of appreciation really goes a long way to cultivating a positive culture.
I'm gonna say people don't leave jobs; they leave supervisors, they leave boss and leaders.
Yep.
They don't leave a job. The job doesn't talk. The job doesn't do anything. It's not that. It's the people who's overseeing and running the job. Um, to your point, one of the things I used to do, right, is I worked in Detroit, and not everybody had access to snacks and food. So I had a little pantry in my office where they can come at any time, no question asked. They can get deodorant, they can get snacks, they can get noodles. We polled them at our staff meeting, what's some of the things that you like? And I went to Costco and we got it out of Costco and it was just there. You come in, no question asked. I don't even care how much you take. I want you to be taken care of, because here's the deal. If your mind, body, and soul is not taken care of, you're not taken care of. And maybe that's the holistic side of me as a nurse, but that's how I view it. I have to take care of that. I have to help them prevent burnout. And you're going to get burnt out if you're not having your lunch breaks, if you're not
Yeah.
taking time for yourself, if you're not, doing the things that bring you joy. Because I have asked you as the cook, and now you're on your 7th day to come in. Why, as a leader, can I not just order in house and bring, Little Caesars or whatever event that can help us? Obviously, we're gonna have to have different diets and things. We can figure that out, but why can't I figure out how to give you a day off if you're on your 7th day?
Yeah, and I absolutely love the idea that you had stuff in your office, because that's the type of leader that I was as well when I was working in the facility. I goodness, I one time bought an airline ticket for one of my CNAs because her brother died and she couldn't get to the funeral.
Wow.
And she was devastated. And I could not allow her not to go to her brother's funeral. So I bought the
Yeah.
ticket. She paid me back eventually, but she didn't
Yeah.
have to. But that's the type of things I do. Now, I do want to say, though, that you need to be very careful when you're doing that kind of stuff, because sometimes people can take advantage of you.
Yeah.
And and the other thing is we need to practice what we preach as leaders. So we are telling them, you need to take a day off, you need to take care of yourself. And a lot of times I think leaders are so busy taking care of their staff that they're not taking care of themselves as well. And so we can't care for others if we don't care for ourselves first.
You know what? You are 100% right. And that's one of the things I pride myself on. I know some people say there's no such thing as a work-life balance. Let me tell you, when I get home, I got a 7-year-old. Then she's 7 now. But when I get home and it's her time, because here's the deal. I can't get that back. I can always find another job. I love my job, but I can always find another one. But once she
Right.
turns 8, I can't get 7 back. I can't get
Right.
that first recital back. I can't get those things back. So why I do understand, I've learned over time, and I'm still learning and growing, that I have to really practice work-life balance, and I have to do that with my team. So one of the things I've done in a leadership perspective, and I heard people say, "Oh, wow, I can't believe it." If I have a team member who's on vacation, if I have a director who's on vacation, I have done it, and it may not be popular belief, but my DO ain't go on vacation. You on a cruise? I'm disconnecting your email. You're not checking your emails. You're not doing things. I really want you to be there in the moment for your family. And I had to do that back in, I think, 2021. I had a DON who was gone. I'm like, we got this. Stop calling in, right? They just had to be involved because that's who we are. But I had to remove her access so she can enjoy her trip, because I was a leader
Right.
who really wanted her to enjoy her trip. And as I talk about leaders who really want to, learn more about their staff and really be there by their staff, a Packin has developed this state interview retention plan. And I think that from that, you can strategize what you need to keep your team to stay. But talk to us about this state interview retention plan.
Yeah, so I really love this. And for those who don't know what a state interview is, when people leave, we always do an exit interview, right? So a state interview is for those staff members who still work for us. And we want to
Yes.
use this tool to identify the most important reasons that our staff members stay, and to get a pulse on our staff members. And then if there's issues, we want to collaborate with that staff member, and maybe other people as necessary, depending on what the issue is, to develop an action plan to retain that staff member. And most likely, if something is happening with one staff member, it's probably happening with others as well. So I love the state interview idea. I think, a lot of times we do resident satisfaction surveys. Well, this is kind of like a staff satisfaction, although it's a little different because it collaborates with that staff member to find a plan and to develop a plan to keep them and to fix the problem, hopefully. And there's several questions in here, like, what do you look forward to when you come to work every day? What difference do you want to make here? What talents? And I think the question number 3 is huge. What talents, skills, or interests do you have that we haven't made the most of?
Woo!
What have we not tapped into? That question just blew me away. What feedback or recognition would you like that hasn't been provided? What flexibility or resources would help you to maintain a balance between your work and your home life? And the last question is, what keeps you working here? Why are you still here while others are gone? And then there's an area to discuss and write down the issues and the priority. If there's more than one issue, let's face it, we can't fix all the issues at once. So prioritize the areas for retention. And then down at the bottom is kind of like a little plan. What's the action that's going to be taken? Who is responsible for that action? Is it somebody from leadership? Is it the employee themselves? And when will the action be taken? And then the very last part of this interview is the follow-up, because that is the most important. All right, we put a plan in place. Did the plan work? If it didn't, why didn't it work? What do we need to change?
This is amazing, because I don't know many people that do stay interviews. We do what you call, right, an exit interview, but are we doing stay interviews? And
this,
it's
easy and it's proactive. It's thinking out of the box.
I agree. So here's what I'm going to do, because I think Alpacin is giving this away. Is that correct?
We are, yes. For anybody who is listening to this podcast, they are going to get this tool for free.
So, excuse me, let me fix the retention. let me fix the, we ran out of words there. That's why it's like that. So I'll just call it stay interview. We'll leave that up there. And if you want this, all you have to do is pull out your phone, unless you're on your phone, pull out your phone and scan the QR code, and that's going to take you right to this form. You don't have to register. You don't have to be a member. Alpacin believes in you, and they want to strengthen the long-term care community. And they did that by developing this state interview retention plan. Once again, there is a total of 6 key questions. And like yourself, one of the ones I'm very interested in is, what talent, skills, or interests have you not been able to make the most of? And when you start asking that question, I think you'll be shocked at the amount of answers that you get. When I was going through COVID, I can't tell you how many people stepped up and said, you know what, I can do this. Back during COVID, when we didn't have gowns, we had people sewing things, because that's what they do outside of work, right? You have people sewing things. We found out people who can sing, right? We got on the loudspeaker. People couldn't leave their room. We had people who I didn't know could sing. They were singing to the residents who were in their room and could not come out. Things like that. And you don't know that without utilizing a tool like this state interview retention plan. So if you are wanting this, once again, this is free. It is in the show notes, but I've done you one better. I placed it on the screen. It is on the screen. All you have to do is pull out your phone and take a picture of this. pull out your phone, take a picture, and if you want more information about a packing, I am flashing that on the screen as we speak. AAPACN.org. That is the organization. Now, Denise, we didn't talk about the organization. Tell us about the organization.
We did not. So, APACN, we are a nonprofit organization that supports nurses, other healthcare professionals in the post-acute care setting. And we provide education, certifications like for your MDS nurse, we have the RAC-CT, we have the Director of Nursing Services certification, we have QAPI certification, which administrators should be very interested in, and other resources to enhance your professional development and improve the care that you provide to your residents. And we also have a really robust community for our members where they can go and ask questions, and other members may answer the questions, or one of our experts may answer the questions. And that it has been a huge support to our members. That's just a little bit about APACN.
And, I recently became a member of APACN moving here in Hawaii, and I needed it more than ever because I'm cliche, but I live on an island in the middle of the ocean. So I'm literally on an island in the middle of the ocean, and I needed to have that connection. I needed to be around like-minded people who understood what I was going through. And what I loved about your organization is it's not only for nurses, it's an inclusive organization. As you mentioned, you have the QCP certification, which I have. I have the QCP certification because I love all things QAPI, all things root cause analysis. And I felt like I was embraced as I went onto your site and learned about the things. Once again, it's not just nursing related, some things that help me as a nursing home administrator. So thank you for all that you guys do. What is your title over there again? Because I think your name's at the bottom of a lot of the documents I see.
Yeah. So I am one of the curriculum development specialists, and I'm one of the nurses that develop the educational materials, the certifications,
Wow.
and the free tools that we give to our members every month, because we put out new free tools every month that our members can take advantage of. And like you said, we have a lot of organizational members. So their corporate decided, hey, this is a great thing. So they bought it for all of their facilities. And we have a lot of education and stuff that is great for all staff. And I am just so proud of everything that we do at APACN to give back to the long-term care community.
So speaking of the long-term care community, and we're getting ready to draw this to a close, and I hadn't shared, what I'm going to share with you, but SMK Medical will provide 0.5 CE for this podcast. So if you're listening to this podcast, you just need to finish out the podcast and once again scan the QR code to get your CE. You're going to do, of course, the evaluation of the podcast, talk about what you learned, and tell us about how you can implement some of the strategies we've given you into your current practice. And for all registered nurses, licensed practical nurses, and advanced practice nurses, you will get 0.5 CE for this course. But as we get ready to draw this to a close, I want to ask you two questions. And the first one is, what do you believe is the biggest misconception about long-term care?
Oh, I think the biggest misconception is that we don't give good care.
Yes.
I think that there is so much on the news that is so negative regarding that there's not enough on the positive. And we do so much for these residents. They are our family. I mean, my husband used to tell me when I was a DOM, because every time I went to the grocery store, I would make sure that I got pickles for this one resident, potato chips for another resident, popcorn for a different resident. He goes, my goodness, you spend more money on your residents than you do your own family. But they are our family. And so
Yes.
I think that is probably the largest misconception, just off the top of my head.
And my final question for you is, if you could change one thing about healthcare, what would it be?
Oh, there's so
Hey, I
many
got some good
things.
ones.
I think the one thing that I would change is how payment drives care.
Where's my clapper?
Because payment should not drive care. I mean,
Yeah.
we should provide the care that every resident needs, no matter. Although I do believe that we provide care, or at least I know I do. I can't speak for everybody out there, but I provide the care that a resident needs, no matter their payer source, no matter
Mhm.
their belief, no matter what. I give them what they need. And I think that's how that's what I got into healthcare for. I got into healthcare to help people, not to make money.
Wow. I am a fan. I appreciate you for coming on. Today we covered so much, but I really want the listeners to really think about doing state interviews to increase their retention. We know CMS, once again, is attempting to put staffing mandates in place. This podcast was not to discuss the staffing mandates. We wanted to approach it from a different angle. So hopefully, Denise, this was a refreshing angle from your standard. What are we doing about the staffing mandates?
It was. I really, really enjoyed our conversation today, Demetrius. Thank you again so much for having me.
you know, we're so grateful to have you, and we're so grateful once again for Packing to have the state interview retention plan that you can download for free. The link will be in the show notes. It is also on the screen. Pull out your phone unless you're on your phone or you're listening. Because if you're listening, you can't see it. But you can take a picture of this and get right over to that and download it for free. Denise, how can they reach you?
I can be reached by email at dwinzler, that's DWINZ as in zebra, ELER, at aapacn.org.
Such a powerful conversation, such a needed conversation for our staff in long-term care. And if we can improve the retention for our staff in long-term care, we can improve care delivery. And I, as a registered nurse, am all about improving care delivery because one day I will be a patient. There's no if, there's no and, there's no buts. We are all getting older and we need care at some point. So we want to have qualified staff. We want to have happy staff. I can't tell you how many times I've gone to, the local supermarket, the local fast food place, and that person was not happy to be there. Now you put that person in a long-term care facility, and I have to depend on you to get up out of bed. I have to depend on you to, take me to the restroom, and you're not happy. So as leaders, we have to keep our staff. It's not all about bringing in new staff if they're just walking out the back door. Once you have them, what are you going to do to keep them? And this podcast discussed skills and strategies to keep your staff. Once again, on the screen is that state interview retention plan. It will be in the show notes. So thank you, Denise, once again.
Thank you again. I enjoyed it.
And that wraps up this episode of Common Ground with SNK Medical. A huge thank you to Denise for joining us today and sharing her invaluable insights on staffing retention and the key to a loyal long-term care team. We hope you gained some fresh perspectives and strategies along the way to help you in your practice. Now, you've made it to the end. So what I need you to do is fill out this QR code here to get your CE. Let me take that one down because I don't want you filling out that one. Fill out the QR code that I'm going to put right here to get your CE. You will get a CE for listening to this. We want to know what you thought of this episode, and we want to know how you're going to use this in your practice. If you found today's discussion helpful, don't forget to like, share, and subscribe to this podcast on all your favorite platforms. Follow SMK Medical on LinkedIn and Facebook to stay up to date on future episodes and exclusive content. And if you'd like to be a guest or have a topic you'd like us to cover, feel free to reach out to me at info@smkmedical.com.